going to the hospital, not knowing what's going to happen. Lots of strangers that are, well-intentioned, nurses and doctors coming in and out of your room, checking on you, but you just have this feeling of anxiety, like who are they, where am I at, and you lose total control of what's happening to you.
When I first arrived at the hospital, I didn't know what to expect. I was really anxious. I was actually terrified. I don't like the idea that I have to be in a hospital.
Being a patient is very nerve-wracking. They're very anxious, and it's not a place that people choose to be.
Mrs. Smith was a little anxious, very nervous. She didn't really know what was going on. So I explained a bit of the board to her. We have her pain medications on there.
One of the most important things that I know of is taking care of pain control. And that's the first thing that I want to know actually in the morning when I come to round on a patient is how is their pain.
One of the tools that we use to really help incorporate patients into the plan of care is the Road to Wellness.
It's this wonderful board that they put the information on there that I give them. They put the information on about what my meds are, where am I at.
It's right in front of the patient, it's also right in front of the nurse. So when you walk into the room, we can walk up to something and point to it and say, this is our plan.
The board helps me to understand exactly how my patient is doing on an hour-to-hour basis for the prior 24 hours.
And even when there's not a nurse or a doctor in the room, I have something in front of me that I can see where I am, where am I feeling, and then it kind of like gives me feedback to something that's going on with me, like, oh, I'm feeling better.
And from a physician perspective, it's very reassuring to know that the patients are understanding these choices and are actually a part of the treatment decisions as well.
My husband is going to be my #1 caregiver.
I utilize the board as actively as possible with the family members.
I really appreciated that not only that I understood what was going on, but my husband understood what was going on.
The My Road to Wellness will incorporate, what medications they're taking, what their activity is, what their restrictions are, what they can eat at home, and when to follow up with a doctor.
The board allows the clinical care team to be aware of important educational points that can be emphasized. The red tabs allow the patient and the clinical care team to know which areas to focus further.
We have education tabs that we flip once we go over them with the patient that will help the patient stay away from having to come back to the hospital.
The relationship I had with my doctor, I feel, with the board was really helpful because when he came in, he could see where I was at and he had a clear idea of the journey that I was taking and how close I was to going home. And then when he did sit down to talk to me, I felt as though he had the information he needed so he could focus more on me as a person and see how I was feeling about my recovery.
So on our chart we have the What Works For Me section, and that's the part that, kind of let the patient decide what works for them and what helps them heal better.
For example, we ask the patient, what works for you when you have pain at home? It could be just watching my favorite show on TV or having my pet beside me. That will help because we have these services here at Cedars-Sinai.
The Road to Wellness is a way of actually discussing some of these issues at an earlier part of the hospitalization, so as questions come up, the patient can confidently ask these questions to anyone on the care team, as well as reiterate some of the major goals of their treatment plan.
When patients are ready to be discharged, I think they feel a lot better with the board. It shows them that they already know what they need to know.
Here's my personal journey right here to wellness is for me to look at. That's going to help me get better, and it's going to help my husband help me get better. And we're both partners in this wellness journey.
In my opinion, compassion is a connection. It's a genuine connection that one attempts to make with another individual.
And with that kind of confidence, I didn't have any anxiety about going home. I felt well cared while I was here. I felt well cared in getting prepared to go home. And I feel that once I get there, they're still there for me.
To me, it made me get better faster. My recovery time was better.
It made me feel as though everything was coming together and that my support was complete and that I was really sincerely ready to go home, because between him and me as a team, we had both covered all the bases, and now the journey was complete.